instruments, just the same. A big rich for such a small tray. I'll put these here. You see, I don't have to think of where I'm gonna put this because all I have to look is for the teeth. Because I always put them the same. These are dressing forceps, I put them back here. Because you don't hardly ever use dressing forceps. Ever. Always get rid of all your garbage. The faster you get rid of your garbage, the better it will be. Well, how do you guys need? And I load my why would this have needle drivers on the beginning of the tray?
Probably confused with a mosquito.
I always load both my
blades.
Even if I'm doing a laparoscopic case, I'm always gonna load both my trays just in case. So I'm ready to count.
Okay.
Okay. These open?
You didn't put any.
Huh?
You don't put
They
any.
don't have any instruments in there. And there's no bladder blade on this either.
No.
Eso lo habían hecho una copia, ¿te acuerdas?
Sí, por eso actually, in the morning I have to put it on.
So that's it. There was no need to move anything around. And this is how I want you guys to set up. Steri strips, if you're gonna open them, they cannot be out. You know why? Because that's to put dressings on the patient after the case. If you have them out there, what's gonna happen? They're gonna get dirty.
Dirty or wet.
They're gonna get dirty. You're gonna have blood on the field. You're gonna have whatever. This is a specimen cup, and this is
Medicine.
a medicine cup. It's not. They have it backwards. They have appendix on this, and they have one or the other. And actually, on my actual setup, I put this here because my thing it's deeper, so I put that there because if this spills,
It's in there.
I could always go like that and I scoop it up and I save it. And I have two of these, so I put one. I put my sharps, this things. I put it there, and then the other one I put.
The medicine.
And I'm always ready for with my syringe and my medicine. But what I want you guys to get from this is don't move your things around.
Don't touch anything.
Don't touch anything until you're ready to
are
put it where it
put-
goes. And that's it. And this is exactly the setup I want you guys to have. I don't want you guys to do anything else other than this. Doesn't matter what tray it is. I want this towel here. I want this here. I want this here. I want this here. I want this like this. Okay? You could put this on top like that, or you could put it this way. It doesn't matter. I do it this way. I actually don't do this. The way I do this with my surgeon is this.
Regular.
Nope. I go like this. I take 1, 2. I take my towels. I put 4 towels there with a 3/4 sheet. And this. Ellos mismos hacen eso. don't do any of that. With my surgeons.
Yours.
In your house.
When I'm with other surgeons that are not mine, I hand them the towel. If it's other surgeons that I have confianza with, I do that. Because if I'm in a hurry and I need to count, while they're doing that, I'm counting. I put this is my setup for laparoscopic. I put the camera and light cord here, insufflation there, 1018 suction irrigator, light handles. Bobby and camera handle. I bring this over here, put the drape on top of that. Ya ellos tienen todo eso ready, and I do what I need to do. Buys me time if I'm in a hurry. So your mail, the order of operation is, this was one of the first things I got ready, right?
The first thing.
Because I didn't have my instruments. Once I got my instruments and I got it ready, I need to get ready to count, correct? Then I load my knife handles. My next thing to do is to get my mayo ready, because that's what I'm gonna be doing. So when everything's said and done, what is the first thing I'm gonna be doing? We're gonna be gowning and gloving the surgeon, draping the patient. The first thing he's gonna ask for is a marking pen, right? You need to have the 2 laps up. He's gonna ask you for the blade. You're gonna need 2 hemostats. You're gonna need pickups. He's gonna wanna retract. Okay? The deeper he goes, he might wanna have cokers. Okay? Your basic start, you need to have that on top of your mayo. So that's why we need to anticipate, what is he gonna do? Once I give him the towel, then they drape, then what? He might wanna mark the skin. They don't always mark the skin. But if he marks the skin, that should be on your mayo. Knife, when you give him the knife, marks the skin, this should be there. The 2 laps, 1 on each side. Start cutting. They want to be able to see what they're going into. You need to be able to retract. They go deep in the tissue. You need to have cokers, which these are not cokers.
No.
Which I don't see cokers in this tray.
Maybe they didn't
Yeah,
Maybe
there are.
cover.
No, there's they are. So they need cokers. Why? Because they're gonna grab that fascia, pull it up to continue to cut. Okay? So you're gonna put 2 cokers. They might need to dissect. That's why you need the tonsil. The Alice, what is the Kelly for? Clamp. If they come into a blood vessel and it starts bleeding, they need to clamp that vessel. You wanna clamp. When they clamp, what do you need? A tie. When you have a tie, what do you need? Scissors to cut, right?
Yeah.
And usually they tie, clamp, and then they do it again, because it's one end. There's 2 ends to each vessel, right? So you're gonna need 2 ties. So those are the things that you guys need to anticipate. Once they start going in deeper, they're not gonna wanna have anything with teeth, because then you're going into softer tissue, more delicate tissue. Then you need to have the bakies up there, okay? So those are the things, you know, Alice, because they might want to guess it. You need to have your Kittner ready, because they might want to dissect an area. So those are your basic for an open case. These are the basic stuff, but those are the things that you need to think for yourselves before he asks you. You need to think, what is it that he's doing? Where are we? That's why it's important to know anatomy. What is he doing? If you see he's doing bowel, that the bowel's gonna, once he goes in there, that he's inside the abdomen, you don't want to give your surgeon anything with teeth. And he might not ask you. He's just gonna say, let me have forceps. You have to know that you can't give him a Bonnie's, because this is for tough tissue. You use this when you're gonna close the fascia at the end of the case, right? So you're not gonna give him Bonnie's. You're not gonna give him a rat tooth. These are all forceps. So he's not gonna tell you, give me a rat tooth. Sometimes they'll be specific. But a lot of times, sometimes they'll just be like, let me have a pickup. You need to know what is he doing. You need to know your anatomy. You need to know your tissue to know whether to give him this or give him this. Okay? So those are important things that you guys need to know. So that's why it's important to always set up the same way. My DeVakis are always on my right side. I'm right-handed. So I'm always gonna grab what's to my right. So I'd rather grab something that doesn't have teeth and then let it not be, than grab something with teeth and God forbid that he grabs it and makes a bleeder or, you know, makes a hole or something where it's not supposed to be. Okay? So those are the things you guys have to be aware of. What would I put in here? I would put 2 or 3. So you have to think, what am I doing? Do I have a big case that I need to have a lot of instruments? You always start with the basic. Depending what the doctor is working with, then you work your way up. Okay? You're not going to start with your whole tray on top of your Mayo if you're doing a huge case. But guess what? Just start with the basics. You need clamps. You need Kellys. Have a tonsil. Have a right angle. And then you're going to see that a lot of times they're just going to use the same instruments back and forth.
So you know.
So then you limit and then you take things off from your Mayo. Okay? I've worked with a surgeon. All he does is uses a right angle. Huge open cases. Just a right angle. All I need is a long right angle and a short right angle. As long as I have those two and hemostats, I'm good. Always have the Mayo and the Mets. And that's it. And I keep my Kellys too. But for the most of the surgery, he uses the right angle. So you guys have to, through the surgery, you have to ask, what is he doing? Listen to what they're saying. If they're dissecting and you're just looking at the time, what am I gonna have for lunch? And then this weekend, I'm gonna go out to the movies and maybe I'll see this guy, or maybe my friend is gonna text me and we're gonna go to the beach and hang out and the surgery's going on and your mind is somewhere else, you're not gonna be a good tech. There might be days that you're gonna daydream a little bit, but in this profession you cannot daydream because things change in a heartbeat. And it's happened to me. Not that I was daydreaming. I was teaching someone. And I didn't notice that there was bleeding going on. And he turned around and this is not the time to teach. I had to tell the person, it's like, I need you to step back. And then I needed a whole mess of things that I needed to get. And things changed in a heartbeat. So you always have to be looking at the monitor. Sometimes it's hard depending on where you work. Like my facility, we teach. It's a teaching hospital, so there's the surgeon, a fellow, a resident, medical student. Sometimes I have a tech that I'm orienting. So in the field, I could have, depending if it's a large case, I might have 2 or 3 surgeons at the same time. So I might not be able to reach, right? So I have to look at the monitors and listen to what's going on. And they're sometimes bigger than me, so it's like even if I try, I can't see, you know? So another thing that I want you guys to be aware, you're stiletto, right? What is your field? From we say your chest line, your nipple line to your belly button, right? It's considered sterile. Anything below that, it's unsterile. So let's say the table, your doctor is really high, or is really tall, and he puts the table like all the way up to here. What are you gonna do?
It's a stool.
You have to adjust yourself. You can't stay here because you're no longer then sterile according to the field, right? Those are things that you have to keep in mind. So I don't like being on those steps because I don't feel secure. I feel like I'm gonna fall. But at times I have to, because then they're not tall. My surgeons are not tall, but when we have big patients and then the table goes up, everything's up here, So everybody